Welcome, everyone. My name is Kimberly Doris. I'm the Executive Director and CEO of the Graves' Disease and Thyroid Foundation. Today's program is the second in a new series called Community Conversations, and our topic today is long-term use of anti-thyroid drugs. For more information on the Graves' Disease and Thyroid Foundation, you can visit our website at gdatf.org. Today's recording is intended to be kind of a companion piece to a webinar that we recorded about a year ago featuring endocrinologists Dr. Eve Bloomgarden and Dr. David Cooper. And that webinar, which I highly recommend, really dug into the details of how anti-thyroid medications work, what the potential side effects are, kind of the history of how doctors have used these medications, and then also the latest research and how that's changed the medical guidance. So again, I highly recommend that, but our goal today is to kind of help people understand what this looks like from the patient side. And just to note that we're not saying that this is the right option for you. That's a decision that should be made in conjunction with your doctor and after reviewing the risks and benefits of anti-thyroid drugs, radioactive iodine, and surgery, and making the decision that's specifically right for you. So we'll go around and do a quick introduction. I'll start, and then we'll go alpha order by first name, because I think how we view each other on the screen is a little bit different. We did have one panelist who had to drop out because of a doctor's appointment, and we have another who's joining us on the way home from the doctor's office, so hopefully she'll be able to keep her connection throughout. But you know, this is the world that we all live in with you know, doctor's appointments, and you have to take the opportunities when they come up, and also dealing with technology. So again, I'm Kimberly. I was diagnosed with Graves' disease in 2007. I took methimazole for 7 years. I had 2 years where I was technically in remission, which is normal levels with no medication, but then I spent the next 2 years sliding into hypothyroidism, which is where I am now. I will turn it over to B for an introduction.
My name is Beatriz Mallory. I'm also known as B. And my journey with Graves' disease began probably about 12 years ago. I was undiagnosed for about 7 years of that. And the symptoms got worse and worse, and finally was diagnosed in 2016 with both Graves' disease and Graves' ophthalmopathy. So again, thyroid eye disease. So I do have the unfortunate eye involvement. I've been on methimazole for since 2016, and I am technically in remission, and also have seen some increased activity in my eye disease, unfortunately, but have seemed to be stable with all of my other symptoms. I hope that's helpful.
All right, thank you. Diane?
Hi, I'm Diane Arndt, and I was diagnosed with Graves in 2005. I was on methimazole for a total of 16 years until I developed what was described as a huge goiter, and I did have a total thyroidectomy last February. So I was on methimazole, very different combinations of methimazole, anywhere from 5 milligrams once a day to, you know, 5 milligrams in the morning, then maybe 10 milligrams in the afternoon, 2 days a week. A lot of different, I call it cocktails of methimazole, depending on what my endocrinologist deemed necessary. I did go in and out of remission 3 times during those 16 years. And my hope was to stay on the medication, but unfortunately, due to the goiter, that wasn't possible.
All right, thank you. Heidi?
Hi, everyone. My name is Heidi. I was officially diagnosed in Graves in 2019, but for a lot of people, it actually probably started way before that, with a lot of symptoms that were just not adding up. And it took actually me eventually to put it together, because I kept saying, oh, it's an ear infection while you're so dizzy and you're having all these problems. oh, I don't know why your menstrual cycle is suddenly so much lighter and abnormal for you, and and all this stuff. And eventually I finally asked to get tested, and my numbers were off the charts. The Quest actually thought I was hospitalized when I wasn't at that point. Nothing was no THS detectable. Everything else was way off the charts. So that's why I was having so many problems. First call was to the Graves Foundation, and got an advocate from there, which filled me in on a lot of information. I actually went up to one of your presentations in Seattle at that point, to learn a lot about my options. I feel like with a lot of people, I got initially assigned through my HMO a very bad endocrinologist, and thankfully to the Graves Foundation and the ATA, I knew that he was not following current guidelines, and I went and saw a different one. And but ultimately, my symptoms began to subside. I was on obviously methimazole for I think it was 20 to start, and then went down to eventually 2.5. I was very bad at taking them immediately every day, but as of September, I completely stopped under my doctor's guidance. And then I was recently just tested a few weeks ago, and yeah, I'm staying within normal. So I guess they say I'm in remission right now. I only have the only evidence on my blood would be a very minor amount of antibodies showing up by comparison to when you're first diagnosed, of course. So that's my in a nutshell.
Yeah, thank you. Mark?
Hi, everyone. I'm Mark. I was diagnosed with Graves in 2019. I've been on medication for about 3 years now, varying levels of methimazole. I think that a lot of my symptoms were chalked up to stress. I was in school, so it probably was a while before I was diagnosed. And the current plan is will still be on the medication. My antibodies are still high. My hormone levels are starting to normalize, but I will likely be on medication for foreseeable future.
All right, thank you. Tanya?
My name is Tanya Osborne, and I was diagnosed with Graves' disease and thyroid eye disease in 2016. I was probably sick for several years before being diagnosed. And I too was also finishing up a degree when I got sick. So I had a high level of stress. So I'm sure that's probably what caused or what activated mine. I was having horrible hot flashes and racing heart and not getting any sleep at all. And funny enough, looking back at pictures of myself, I looked terrible before I was diagnosed. My hair was all frizzy and I was really skinny and I had a big ring around my neck, which nobody appeared to notice. Anyway, I was put on methimazole for 2 years and they tried to wean me off, and I went right back into full-fledged Graves' disease every time. So I've been on methimazole ever since. I've recently I had a decrease in my TSH levels and I started having really bad symptoms again. So he's increased my medicine again, which is the first time that's happened since they weaned me off the first time. I also, with my thyroid eye disease, that was a pretty long journey for me. And I was able to do the Tepeza last year and it was very successful for me. So that's where I'm at right now.
All right, thank you. So just to note that Tepeza is a medication for thyroid eye disease that was approved in early 2020, I believe. And that's Horizon Therapeutics is the manufacturer, and we do get some educational grants from them, but our content is all completely independent. I'll also note that everybody mentioned methimazole in their introductions, but you might have heard of Tapazole, and that's the brand name, so some people might be on that. And there's also another anti-thyroid medication called PTU that is used in specific situations. And I would refer you to the webinar with Dr. Bloomgarden and Dr. Cooper for more information on that. So let's jump into some questions. So if you think back to the start of your journey, what went into your initial decision to use anti-thyroid drugs rather than going straight to what we call definitive therapy, which is RAI or surgery? And again, we're not saying this is the best decision for everybody. That needs to be made in conjunction with your doctor. But what made this the best decision for you?
I'll discuss.
Yeah.
The radioactive iodine treatment was an option that was brought to me, and quite frankly, it scared me half to death. I didn't like the idea of it destroying my thyroid and knowing that I would have to be on medication for the rest of my life, the other medicine, the Synthroid, or I think that's what it's called. So I was hoping that there was a chance that I could beat the Graves' disease and not have to be dependent on medicine for the rest of my life. But honestly, in my future, that might be something I still may have to consider, since I've never been able to go off the methimazole. So it's definitely something that my doctor is still discussing with me.
Okay. Anybody else? V, you look like you wanted to jump in.
Sure. I felt like I had no alternative really, but to follow exactly what I was told, because I was very, very sick. The symptoms you've just heard, plus many additional ones, almost every classical symptom of the 20 on the Graves list I have had and still do, even though I'm technically in remission and my numbers are good for about 2 years now. I've had no changes to my 5 milligrams a day of methimazole. But I was a walking stroke, which is essentially what my doctor told me when I had a resting heart rate of about 140, 150 beats per minute. And so I had to go on propranolol as well, right from the get-go. But again, my symptoms went so long undiagnosed because I had so many different ones, radical ones. I still get the random rashes. There are days when the tremors are back. The weight loss can be an issue from time to time. So yes, it sounds like I'm not in remission, but I'm so much better than I was. And getting a diagnosis finally, I was so sick, I just trusted my care team. And they said, propranolol right from the get-go, and you're starting with 10 milligrams. I think I was at 20 milligrams of methimazole a day for probably the first 3-4 months until my body slowed down. And once we got to some level of adjustment over time, had a similar journey in terms of the amount of milligrams that I was taking, up and down. And now I've been on 5 milligrams for 5 milligrams a day for about 2 years, and really do feel relatively stable.
Okay, thank you. Anybody else have thoughts on what went into your initial decision process?
Yeah, for me, the other factor with me is I did have a nodule as well. So they were testing and looking at that, and its markers were actually kind of high on the radiologist scale, that it could be indicative of leaning towards the cancer, and that would have ruled out a couple of my options. I did later have a biopsy, and it's not. It's something they still monitor with ultrasound. But reading and listening to the Doctors of the Graves Foundation and the ATA guidelines and understanding them, knowing that there's massive side effects when you actually remove a vital organ from our body, so it's and we see that happen with people who do take those options, then they have another set of issues. So you're kind of, it's like a catch-22, which way you go, you're always going to have some potential side effects. And I really was nervous about losing it. And then when I really went and saw another endocrinologist who was really pushing to try and see, can I go into remission, and gave me a good plan to work towards that and see what my body would do first. And referencing back a lot of the studies and historical evidence that they have coming out of Japan, which goes back and has a lot more thyroid issues due to the war. So seeing what they've seen and what we've been able to therefore replicate in the US and what the ATA guidelines are, it gave me a lot of hope to say, let me try this. Once I knew my nodule wasn't cancerous and I knew I could go down this road and see how my body responded, and it always seemed to progress in the right direction. So that was behind my decision process as of now.
Okay, thanks. Diane, were you gonna jump in?
Yes, I was. I just wanted to share that every doctor I saw, from a nurse practitioner to my primary to my endocrinologist, was really pushing for me to either have the radioactive iodine or the total thyroidectomy. And I really wanted to try to keep my thyroid, obviously, since I went 16 years fighting this. I really wanted to keep my thyroid. And I don't know why I felt so strongly about it, other than, as Heidi mentioned, it's a vital organ in your body. And I thought, I held out hope that maybe someday there'll be a cure for Graves' disease in the back of my mind. And that's why I wanted to be on the medication, the methimazole. And it was working for me. I was very, very sick when I was first diagnosed. My resting heart rate was 160. So I was immediately put on the propranolol and told, not to exercise, not to do anything that could increase my heart rate. And it worked for me. The methimazole did work for me when I was on it. And, looking back, it worked on and off, but it was the right choice for me. I really wanted to keep my thyroid and not be on medication for the rest of my life.
Okay, thank you. Any other thoughts on making that initial treatment decision before we move on? Okay. So next I'd like to talk about what tests do you have run regularly? And how often do you see your doctor? Is it an endocrinologist, or are you now being managed by your primary care doctor? Would anybody like to tackle that one? Yeah, Mark?
Sure, I can start. So every 2 or 3 months, I get my TSH, T3, T4, and sometimes antibodies as well. One of the things that's personal for my care is I'm traveling a lot, and I'm often having to do tests out of provider, not at home. So that's been one consequence of it. Right now I'm living in England, and the NHS is very backlogged with COVID. So I haven't been able to get a test for about 3 or 4 months. But it's all organized by my wonderful endocrinologist and their PA. So we communicate a lot through telehealth. That's one good thing about endocrinology is I personally don't have to have a physical examination all the time. I just send my values over, and then we discuss future steps. So I've been able to titrate medication even without having to see a physician in person, which has been nice.
Okay, great. Anybody else? Oh, go ahead. Go ahead, Tanya.
It's okay. No, I'm just thinking back to, it's just been such an interesting and long process that I've been in remission for long enough that I feel like I'm so well managed that I really don't question as much as I do with so many other things, being someone in healthcare. I question everything, but not my care team once I found the right people. And I have the same exact tests. I do the TSI more often than probably most people. I have all 3 done every 2 months because, again, I'm so well managed that no one wants to tweak anything. And so that's been one of the difficult things for me, wanting to consider over time weaning myself off of an ATD, but I don't think that's going to happen. Because so far, keeping my regimen of testing up. Now, the only issue that is really in flux is continually watching my eye disease. It is considered mild, but I've had it so long that the new treatment is not available to me. And so I have to keep pretty vigilant in terms of spending making sure I'm seeing my oculoplastic surgeon, who hopefully won't ever have to operate on me, as he likes to say. But that is I'm being more vigilant about. But besides that, just my regular every 2 to 3 month testing for all of the above. And I'm happy with that.
Okay. Any other thoughts on regular testing, how often you're seeing your doctor? Yeah, I'll share that initially when I started on the methimazole, I was going in every few weeks, and I can't remember if it was I think it was before they made the first adjustment. I crashed super hypo. When I got diagnosed in 2007, TSH was a big focus. And so they were like, oh, your TSH is still low. We need to increase your meds. And I think that, in the intervening years, doctors are a lot more aware that they need to look at, not just the TSH, which can stay suppressed, especially early in the course, but also your free T4 and your free T3. So that was really critical. So, early on for me, it was every few weeks. Then as time went on, I might have a stretch where I could go 5 months or 6 months in between appointments. And then, I would blip hyperthyroid again. And I was back to the every few weeks. So it was kind of sort of depended on where my labs were at that point in time. And I do still see an endocrinologist. And my doctor also checks my vitamin B levels and my vitamin D levels, and then recommends supplementation if those are deficient. And I will say the GDATF doesn't recommend supplements, but we do recommend that you talk to your doctor about it and testing for deficiencies if needed, and then getting guidance from your doctor on an appropriate dose. So any other thoughts on testing before we move on?
Well, I did want to follow up on what you just mentioned in terms of supplements. It was very surprising to me to hear how vocal my care team members were in terms of recommending supplements, particularly because my vitamin D levels are unfortunately not where they need to be. And so between that and interestingly enough, being pretty much prescribed selenium because of the testing that's been done over the years in terms of it having some level of, some influence or impact on vision, and particularly as the thyroid eye disease progresses. So again, I know I sound like a broken record, but I work very hard to build the right care team. And when some very, very capable and well-known and well-recognized experts are all saying it, it seemed to make sense for me to go on those supplements.
Okay. And a couple of notes on selenium. There has been some research that there might be a benefit to thyroid eye disease. One of the challenges is that research was largely done in parts of the world that are known to be selenium deficient. So there's a question of, does that translate to parts of the world that are selenium sufficient? And another note is, this really needs to be done in conjunction with your doctor. You don't want to go eat and then, take an entire bottle of selenium or eat a whole bag of Brazil nuts, because it just takes a couple to get your RDA. And selenium is one of those supplements where you can have negative side effects if you go over the recommended amount, and it doesn't take very much to go over that RDA. So, that's something definitely talk to your doctor about, and then work within your doctor's recommendations. Tanya, were you going to say something about testing?
I was going to comment on your story that you had said, Kimberly. I think I also went into hypothyroidism at the very beginning and had the hypothyroidism symptoms, which was also weight gain and just feeling lethargic. And it does take a while to get leveled off, I think, and have your numbers in the right range. And I also can say, just because my numbers are in the right range, sometimes I still don't feel right. And I question if I'm still in the right spot. And I don't know how to communicate that sometimes to my physician when they're like, nope, your numbers are in range. You're fine. This isn't your Graves' disease. This is something else. And I'm like, and I have that conversation a lot. And I struggle with that throughout the years I have.
Yeah, that's so frustrating. My levels are normal, but I still don't feel good. And Tanya was kind enough to join us for another in this series on navigating the new normal, where we, talk about, yes, patients, years after a diagnosis sometimes still can have these lingering symptoms, and we don't completely understand why.
I believe one of the ones that's so complex is fatigue, because it is, fatigue and brain fog, because they are so prevalent in other conditions that sometimes they will be, particularly if one is in sort of a remission state, to find that you're still having to just collapse in the late afternoon for a while. It's very frustrating. And so, yes, the symptoms that unfortunately continue to manifest themselves, no matter what we do, can sometimes be dismissed. And it's something we have to watch for. And it's one of the reasons I think that so many of us who've been on this journey for a long time can be helpful to those who are just beginning.
So
Well,
one
of
way
course. I'm
one way
sorry.
that I frame it is that, you know, even if your levels are normal, even if the tests come back normal, Graves is just one potentially small part of an autoimmune journey that your body is going through, right? And I always love to bring up, you know, thyroid eye disease as a connection, because most people don't realize that, you know, they're related, and that people with Graves are often at higher risk of other autoimmune conditions like rheumatoid arthritis. So, you know, the conversations I have with my healthcare professionals, and they're very accommodating, is that, but it's mostly with the public and, you know, friends and family, is that I have good days, I have bad days, but also, you know, levels in one blood test at one point in time is only, you know, one marker of what I'm going through at a time.
Okay, thank you. Tanya, were you going to add something?
I was just going to also comment on what B said. It's really easy to be tired every day when you can't sleep.
Yeah.
Understand that.
Sleeplessness.
I have not slept a full night in 7 years without waking up. And I've had sleep testing done, and my sleep testing fails because I can't stay asleep.
Oh, wow.
So that affects everything, including the Graves' disease, which not being able to sleep is caused by the Graves' disease. So it's like a vicious cycle.
Very much. Very much. Sleeplessness is, I just have a horrible relationship with sleep, and it's just had to turn into a regular part of the routine for my eyes as well, to shut down for an hour in the middle of the afternoon. And that's the term I use, just shut down, to enable all of the symptoms and whatever, again, the whole concept that it's our immune system at war with us, and just having to fight by being stronger and resting more and doing whatever we can. But it's really difficult. Tanya brings this up beautifully. It's just, you have to ride this. It's almost like surfing waves. You just have to be conscious of what these symptoms are and just really catalog them, so you understand what's a Graves' disease, what isn't your Graves' disease, and anyway, address it as best you can.
Yeah. And that's a great idea, to keep a symptom journal. And it can be really challenging to sort things out, you know, and for those of us who are women of a certain age, then you throw menopause into the mix, and, you know, what's the Graves, what's the autoimmunity, what's the menopause, and it can be really challenging to sort all of that out. Any other thoughts before we move on?
Yeah, I'll just throw it out. I totally agree with the vitamin D issues, and you know, all that, making sure you're taking some good supplements on that. I do. And then the other thing I would just say when we're talking about supplements, just to make sure people listening to this are aware, biotin, which we often use for our hair and nails to try to help us, does actually interfere, or can, with the preservatives in the vials that they use to collect our blood. So I always make sure people, I didn't know this initially, and I'm glad that lab tech and stuff had that taught me, told me that you should probably stop that a couple of days before you are going to go get to your levels tested, just so you don't have a false reading as a result. So I always like to flag that kind of stuff that I've learned for other people, because I didn't know that when I was first diagnosed either.
Yeah, that's a great point. And it's something that's really come up in the last 3 years. We've started to see some research on that. So definitely talk to your doctor about that particular supplement. And, you know, you hear differing stories. Some doctors will say stop it for a couple days. Some will say 7 days. But definitely that's something to be aware of prior to getting labs. So I want to shift gears a little bit, and something that the webinar with Dr. Bloomgarden and Dr. Cooper kind of emphasizes is sort of the history of how anti-thyroid medications have been used. And for many years, there was kind of this thought that, okay, well, 1 year or maybe 2 years, that's all you should take anti-thyroid drugs for. And when your 2 years is up, you withdraw the meds. And if you're in remission, yay you. If you go back into hyperthyroidism, then it's straight to RAI or surgery. But in recent years, we've had more research on the long-term use of anti-thyroid drugs, and you've seen groups like the American Thyroid Association providing some support for that. And also more and more doctors being willing to let patients use that. So I'm wondering if anybody ran into a wall when you were at the 1 to 2 year mark and either had to switch doctors or have a discussion with your own doctor about continuing with the medication, or was your doctor on board with the longer term approach? Yeah, Diane?
So I can say that my endocrinologist and my primary were not on board with the long-term use of it. And I just think it's, from years and years of saying, like you said, you should only be on the medication for a short term, but I really had to push and be a champion for my own health and say, this is what I want to do. And eventually my endocrinologist came around, and it kind of got to be a joke where he'd say, okay, so you still don't want to do surgery, or you still don't want to do radiation? And I'd say, nope, I want to continue. This is my journey, my path, and I'm in charge of my own body. So he finally did come around, and he was willing to work with me, but it's almost as if I felt I was educating him that there are other choices. It's not just, one and done.
Yeah, kind of, I sort of had the same experience during my 7 years on the methimazole. After, a couple of years, I would go in and they would go, okay, you could have RAI or surgery, right? And I'd go, yeah, I know that. And they'd check the box and they would move on. So any other thoughts on getting past that 1 to 2 year hurdle with your doctor?
Well, one of the things that I've been fortunate once again, is that being my own advocate, which is a great thing that Tanya said, that you really, both of you and Heidi, both had mentioned being your own advocate. And I'm very fortunate that I will stand tall and say, I'm stable. Why on earth would I want to make any kind of change? Now, if there is some definitive reason, whether it's because of my own biology, whether it's new research that surfaces that says you must stop, absent that, I am not interested in anything that upsets my stability, especially because, I have a career, I'm I have a life to live, and as many of us do, and I cannot afford to have any unforeseen issues. That all said, my newest endocrinologist in our very first meeting said something that completely surprised me. She said, well, what's your end game? I said, excuse me, end game? She said, eventually you will need to make the decision between RAI and a thyroidectomy, and which are you going to do? I said, I have to think about that now. How about we stay informed, see how things go. And when the quote end comes, where I have to have a quote end game, well, I've already thought it through and I know what I want to do. But, who knows how long that's going to be. At this stage, once again, I am stable. Why rock the boat?
Yeah, any other thoughts? So the next question, I think we've kind of answered. It was, who's managing your care? Are you back to your primary care physician? Are you still with an endocrinologist? And it seems like everybody on the panel is still with an endocrinologist. Is that correct? Yeah, I am as well. So we touched on this a little bit during the introductions. It sounds like we've got some who took anti-thyroid drugs consistently and some that were in and out of remission. So I'll ask a couple of questions about that. So if you have stopped the meds for any period of time, can you share what that process looked like? Did you just go cold turkey and stop the meds? Did you slowly taper off? Was your doctor testing antibody levels to see if you could go off? What does that process look like? And Diana, yeah, I know you've done this multiple times, so.
Right. So I went cold turkey every time.
Wow.
And even though the doctor had tested my antibodies and they were very high, my wish was to go off the meds if I could. So, and he supported that, my endocrinologist did. So it was cold turkey. And then, you know, as I went in for my regular tests, depending on how I was feeling, probably every couple of months at that point, I knew when I needed to be back on. I didn't need the tests. I knew as I started losing weight that it was going to happen, but I didn't want to admit it to myself. Yeah. But that is how it went, cold turkey. Now that I've done some more research, I wish I would have done more of a tapering off, and maybe I would have had more success. Maybe I wouldn't have, but yeah.
So you kept in close touch with your doctor though, even after you know, each time that you stopped the meds. It wasn't, you know, hey, I'm done, I don't need to see the doctor anymore. You still had that relationship.
Absolutely.
With the endocrinologist.
Yes, with the endocrinologist. Yes.
Okay. Yeah. Any other thoughts on stopping the medication?
I stopped briefly, probably 2 years after I was diagnosed. And I think I was on 5 milligrams at that time. And he put me down to 2.5 milligrams and I was doing okay. But I did notice that my TSH was falling, like on the blood test. But he was like, let's just see what happens. Let's go ahead and take you off. And I do remember how good I felt once I went off the methimazole. And you guys probably know that taste you have in your mouth all the time that never goes away. That went away. I had energy. I felt really good. And then all of a sudden I was so ramped up and I noticed it. I was actually at a doctor's appointment. My heart rate was 140. I'm burning up and I'm sweating and I'm like, what is going on? And then I realized like right then that I needed the methimazole. So, and I did keep in touch with my doctor. So they caught it really quickly. I think it was probably 6 weeks. He took blood again, but I just wasn't able to, my body wasn't able to fight it. And I had to go back on the methimazole. But so far, like I've not had any issues. Like I don't have any bad side effects with methimazole, other than I know I felt better without being on it in general, like just not medicated. And it was just really nice for a little while, but it's just not worth it. So I'm hoping that I'm probably going to be one of the people that has to stay on it forever. I mean, but that's okay.
And I hope we can get Heidi back because I would like to get her take on her approach to going off the meds. Oh, there you are. Can you, Heidi, did you? Yeah.
Yeah. So, yeah, for the meds. Well, yeah, I mean, first of all, I was kind of bad at honestly taking them. Remember to take them every day, which is another side topic. But yeah, what happened was I test, and what they did eventually was go off. So what I did, so the blood test kept showing that I was going more and more in range. And then it, as everybody knows, became a balance of how to reduce the meds and make that all work while also finding your optimal range within what they consider normal, right? So that was always a balance. And then what happened was, like, in September, I kept talking about wanting to go off, and they were watching the antibody levels and stuff like this. And then September, my numbers were really good. And I was like, look, you know, to be honest, doctor, I was kind of honest, but you know me, I was barely remembering to even take it prior to these tests. So he's like, all right, we'll take you off. And then I had to get the test done again in like January. So not that far long ago. And they held pretty well. So he hasn't wanted to put me back on anything at that point. So yeah, I would say it kind of went to cold turkey too. Like what everybody else was saying, they continuously were dropping my meds. And the other hint I will tell people who are watching this, because something else that I learned is it's always hard to find a good endocrinologist. So in my case, what happened was, thankfully through the Graves Foundation, I found a great list of those that actually do specialize in thyroid disorders within my area. and I called them, even though they're not on my insurance, I did it as a cash only patient. So I always give people that advice because that was way cheaper for me to go talk to them, do everything with them, and then have him tell my primary doctor what tests to run. And so it'd be covered in my insurance that way. So it's how I was able to afford to be able to actually get good care to from people that actually really specialize in this, because obviously my HMO sent me to a generic endocrinologist and wasn't following a lot of the guidelines, or really didn't deal with Graves a lot. So like that would be some advice I would have to people, to definitely make sure you're finding, especially when initially diagnosed. I think now at this point, I don't really see my endocrinologist. I just stick with my primary care, but I would definitely recommend that as an option to people to consider.
Okay. Thank you. And just to note, we do recommend taking your meds every day and being really consistent, doing whatever you have to do to make yourself remember it, whether it's sticky notes or reminders on your phone, or you have a pill box. So we do recommend that, partly, for your health, obviously, but, also to help your doctor help you, because it's kind of hard to interpret tests, if you've been taking medication inconsistently. So we do recommend that, but I'll just share that my process was more of a very, very slow tapering. By the last couple of years, I had a pill splitter, and I was splitting a 5 milligram tab into quarters, and I was taking like a teeny little grain of rice of a pill twice a week. So that was the last dose that I was on before I finally went off the med. So I did end up doing a very long, slow taper.
Frankly, for anyone watching this, I definitely recommend titrating that way too. Because when the one time I did decide, let me take a vacay, I'm really feeling great. I don't know why I have to do this. I'm taking what I consider to be such a small dosage. I considered 5 milligrams a day to be a small dosage. And I just said, you know what, I got to take some time off. And my heart rate shot up. That was the first thing that happened. And I spiked over 160. And I said, whoa, that was a big surprise to really see my heart rate spike so hard. So I think it's something that if I were not in a circumstance where, again, I had a really good endo, who, there was someone I could call right away and say, hey, this is happening. My heart is racing again. First question was, did you stop with your meds? And I said, yeah. And so he said, the first thing we have to do is put you back on. If you feel that within a week or so that you're really able to control those symptoms, that you're feeling less agitated and, less I call it vibrating, less of that. But more importantly, keep an eye on your heart rate. Make sure you have a heart rate monitor on your Fitbit or whatever. And it was a bad thing to make that decision to just say, I'm out. And the potential coronary effect is something that you really have to keep in mind. It seems like a casual decision, but any of your symptoms can go out of whack so quickly. And I'm sure every single one of you can speak to the experience of sudden onset, sudden return of symptoms of Graves.
Yeah, I also want to touch on that. Yeah, with the Fitbit, I definitely have one. And I do still watch it to this day and always track it. But one of the things I would point out to people too, and what made my case, I think, difficult to diagnose for everybody listening, is I was never abnormal enough. So like when I started, I guess when these symptoms really began to show, and maybe I'd be going to the doctor's appointment for just routine stuff, they'd be like, oh, well, your heart rate's like 80 something. I'd be like, oh, that's kind of high for me. And they'd be like, it's not abnormal. And like they would kind of do that. Or my blood was like, I was like, but that's not what my normal really is. And things like that were happening. And then I would be mentioned, oh, are you sure this is really just an ear infection? I'm so foggy, I'm having a dizzy and vertigo. And it'd be like, well, it's your labyrinth. If it gets in there, it can be a long time to recover. And like that kind of stuff. And I'd be like, my cycle seems really abnormal. I've always had horrific cycles and now I don't seem to have anything. And so like all this stuff, but they were never putting it together. And I think that's an interesting part that I know has to speak more to our medical professionals, in that not everybody's going to present on the verge of a thyroid storm or have such elevated heart rates and all this stuff. There's a lot of us who are just, and maybe because we're overall in other ways very good health, that we never spiked enough. So that was part of the reason. In fact, when I actually began to put it together and went to actually ask to be tested my thyroid with my doctor, he was dismissive at first. He's like, really? I don't think you need that. It's not gonna show anything. You might be a little low, was what he said, right? And then obviously like the lab calls about like 6, 7 o'clock the next morning to be like, is she in the hospital? Because my labs were so crazy. But again, you wouldn't know it by looking at me. And I was still very highly functioning, you know, my work and my activities. So that was like, I think that's one of the reasons why I wasn't diagnosed, you know. And then of course, when I went initially to the first Graves meeting within like a couple of weeks of me being diagnosed, everybody else there would have spotted me across the room as having Graves, because they all knew, like, I talked fast to begin with, but there I was on like warp speed. And there were some medical students there. They're all like, look and listen to Heidi and watch how she's fidgeting, watch all the stuff she's doing. Like, she's classic Graves. We don't know why everybody's missed it for so many years, you know? But yeah.
Okay.
I just wanted to point that up.
Yeah, thank you. So for the periods where you've been consistently taking the meds, not in a period of remission or anything, did your dose stay consistent, or did you find that you had periods where you needed a little more or a little less? How did that work for you? Yeah, Mark.
Sure. So I can talk about my experience. So I actually was on like 10 milligrams starting, and that wasn't enough. I had an appointment with an endocrinologist. They were like, are your symptoms gone? I was like, no, I'm still kind of like staying till 4 a.m. and bouncing around the house. So that they ramped it up to 30. And that's when I started really getting side effects. So even on propanol, I started getting I was having rashes. I started feeling out of it. I had to take antihistamines to counter the rash. So, I mean, in this talk previously, we talked about cocktails, and it really is, you know, you're experimenting and trying to figure out what works for you. And then 30 was the amount that started to affect my blood levels in a good way. And then from there, we've been tapering it off. Now I'm at 2.5 milligrams a day. So I also have the pill splitter, and we're doing the little cuts. And I don't have to take propanol or antihistamines, although, you know, I've discussed it with my physician saying, you don't know where this could be in the future, just have those on hand in case, you know, your heart rate shoots up to 160 again.
That was my question. I wanted to know if any of you guys have to take propranolol as a maintenance. Like, I take it twice a day, every day still. And if I don't have it, even though I'm in range, everything is so much worse. And I don't know why that is. And they blame it on anxiety. And I don't think it's anxiety.
Yeah. No, and that's precise, Tanya. That's precisely why I got a Fitbit with the heart rate monitor in it, because what I wanted to do is just keep track myself and manage any anxiety that I would have, because I did not want to go back on a beta blocker. I mean, that's serious medication. And I'm not saying that anti-thyroid drugs aren't serious. All of everything we take can be a very important part of staying stable, but no question that having some kind of a heart rate monitor that is on you at all times, and just being able to take a look at it after you've done something, you know, done a significant amount of exercise, or if you've been sitting for a long time, and just keeping track on your own, mostly to alleviate that anxiety, if you will. Because I don't like the idea of staying on a beta blocker for years and years, you know, for any amount of time. I was off of that within, I'd say 6 months. 6 months, 6 months after diagnosis. And even when I took my vacation, do not take a medication vacation. Do not do it, please.
Yeah, in fact, I was just going to point out that beta blockers are not a medication that you want to stop cold turkey. You want to work with your doctor to taper off, because you can get rebound symptoms if you stop the beta blockers cold turkey. So my doctor actually gave me a prescription for beta blockers when I was first diagnosed, and she said you can take them if you need them, and I ended up not taking them. So is anybody else still on a beta blocker, or you started off with one and weaned off?
I started off, like initially when I was diagnosed, my primary, before I was able to get, you know, my HMO approved and send me to endo, he put me on a standard dose of meth and methimazole and propanol. But actually, as soon as I saw like the endo and everybody, like, they're like, no, just stop that completely. They didn't have me taper off. They're like, there's no need. But again, I was never elevated as high as a lot of people are. So
Yeah.
it actually was, dropping. My resting heart rate's in the high 50s. So it's not like, for me, and nowadays it is. And then back then it was probably in like the 70s. So, and I would never spike that much. So they definitely didn't want me on that. And I also know it does like a side effects too long term as well. So yeah, they definitely are not encouraging to stay on that, at least in my case.
Yeah. Is anybody else on a beta blocker?
No, I'm not on a beta blocker anymore, but each time I went out of remission, I did have to go back on. And my endocrinologist did monitor it. And he told me basically when you feel better, you start tapering off slowly. He was very clear about that. And then you can be off of it totally.
Okay. And just a note for those that aren't familiar with beta blockers, they don't treat the Graves, but they can give you some symptom relief from things like rapid heart rate, shaking hands. So that's why some patients do end up on the beta blockers, and some, Tanya, I have heard of patients that are still taking the beta blockers longer term, at the advice of their doctor.
I have a friend who went back on because she was finding she was having more and more difficulty with texting and with anything, to manage the rapid vibration of the hands. And so she actually went back on to be able to control the trembling and her inability to function digitally in a coherent way. So unfortunately, because that's the world we live in, that's one of the things that we have to manage. And so especially these days when you have to do so much tactilely, and I'm very, very, let's put it this way, I'm dreading that possibility because I don't want to go back on one.
Okay. So as we talk about dosing, I'll just share my experience. So when I first got diagnosed, I was on 15 milligrams a day, and my doctor had me splitting that up into 3 times a day. Pretty quickly, I settled into 5 milligrams a day, but I had probably 3 or 4 periods over that 7 years where my levels started to spike again, and I would go up to 7.5 milligrams a day. And usually that was enough to kind of level things off. And then I would go back down to the 5, and then it was 2.5, and then it was, the tiny little grains. But for me personally, I can link all of those periods where I started flipping hyper again with a specific stressful issue in my life. And I'm wondering if anybody else has noticed a correlation between the course of your Graves' disease and stress in your life. Bia's laughing.
Absolutely. I can almost chart it. And actually, that's one of the things, just all kidding aside, one of the things that actually I do in keeping the journal, which I highly recommend. I don't really even call it a symptoms journal. It's just at the end of each day, I put in my calendar, what did I feel like that day? And, what happened that might either impact or be caused by Graves' disease. And so I joke about it, but you can almost chart if you look back at how your symptoms are progressing at any given time or regressing. You can point to some major stressor or illness, which again, it can be a physical stressor, not just a psychological or emotional one.
Okay. Any other thoughts on stress?
I say it's absolutely related to stress. That's what my diagnosis was, a very stressful time at work. I was working on a major project, 50 to 80 hours a week. And then I was also the maid of honor at my sister's wedding. And that was with my initial diagnosis. Then as I went in and out of remission, it typically was related to a stressful either event or a health issue. And every time I see my endocrinologist, he'd always say, make sure you're working on your stress, be mindful of what's going on in your life. And I did. I started doing yoga, which really helped me. You have to be very aware of your stress levels and how it affects this disease.
Okay. Any other thoughts on stress before we move on?
I think
Actually, just to,
Oh, Mark, and then we'll go back to B.
I just thought it was, I mean, this is a great example of where we say mental health is health, right?
Mhm.
And we see there's a direct link between how we feel in the day and how we process stressful emotions and processes with our physical symptoms. I used to kind of roll my eyes at like yoga and like mindfulness because I was like, all right, that's like, it's all in the mind. But I mean, there is a mind-body connection. And I would say like managing my disease has become a lot easier when I, started treating how I felt as like a very serious part of managing the illness.
Okay. And B, did you want to follow up? Oh.
No, Mark just articulated it. As a yoga and meditation teacher, I can say one of the saving graces of having that practice in my life, yoga and meditation, has been that ability to say, okay, I can manage this myself, and I can give my body additional support by shutting down to some degree the acceleration that is native to our lives. And so sometimes literally just sitting and breathing and just breathing will help so much. Now, of course, when you're really dealing with sluggishness and some of the other issues that make you already feel like you're slowing down, you may not feel that there's any advantage to it, but Mark articulated perfectly. The mind-body connection is real and is a significant doing what you can to manage that relationship, which you can do. I mean, it's in our power to do that.
Yeah, thank you. So we've touched on this a little bit throughout, but have you had issues with thyroid eye disease, also called Graves' ophthalmopathy? I think Tanya, you mentioned that. B, you mentioned that you were seeing an eye specialist. Has anybody else experienced eye issues with Graves' disease?
I've experienced the dry eyes, and I do see the doctor once a year for my exam just to make sure everything's looking good. And so far, so good, but it is very real to have the dry eyes, even if you don't have the thyroid eye disease yet. And I say yet, but hopefully it will never happen, but it is a possibility.
Yeah. Yeah. And any other thoughts on thyroid eye disease?
I think for a lot of people with Graves,
And
it's watching and waiting.
Yeah.
Sorry.
Yeah, no, absolutely.
I would just say, as someone who had both diagnoses simultaneously, although I had problems with my eyes for many, many years before that, but no one had been able to put, again, like many people, I had a very circuitous journey to get to diagnoses, and that included my eyes, excuse me. But I would keep track, again, as you watch your symptoms. Dry eyes can progress to grittiness in your eyes because of your things like your lenses not being protected, because your eyelids don't necessarily close all night. So if you are starting to feel that it's moving beyond just, okay, let me use a couple drops and I'm good today, to feeling more like grittiness and actually irritation on a regular basis, that's something where I would definitely speak to, believe it or not, endocrinologist, not your regular eye doctor. And that's something that people don't necessarily recognize when you, particularly if you're visiting an optometrist. I don't go to anyone who is not treating people with thyroid eye disease, and that's the vast majority, by the way, of optometrists. And I see Heidi nodding her head. You got to ask them whether they deal with it, because they don't necessarily put these things together if they don't understand it. But I would keep a close eye on just any change at all in your eye symptoms, because they can progress very quickly, and it's a club nobody wants to belong to. It's a horror show. So I would really stay vigilant.
Yeah, and that's a good point about just seeing your regular optometrist, because we hear from so many people, especially if they're years out from a diagnosis, they don't make the connection and they go to the optometrist who says they have allergies and gives them some drops and sends them on their way. So it's really important to get that expert help. Tanya, did you have a comment?
Yeah, and be careful with the thyroid eye disease too, because once the damage starts and they don't, there's things they can do now to stop it. And once you have the damage, you can't go back 100% ever. It changes your face, it changes your eyes, it changes your vision, it changes your swelling like above your eye. So if you have any, I mean, just try to get it taken care of as quickly as possible. And if your doctor isn't listening, keep going. It took me 5 physicians. They told me I had glaucoma because my eye pressures were high. They said my eyes weren't moving, and I knew they were. And I finally got diagnosed. And all doctors are not created equal, specifically with thyroid eye disease. It's worse than the Graves' disease, to be honest with you. And that really was probably the hardest journey for me.
I would also strongly recommend looking at some of the resources available through the Graves' Disease and Thyroid Foundation, which is, again, it's really been, you guys have been my really facilitator through this journey. And I'm very grateful for all the everything that you've made available and continue to make available and continue to update on a regular basis, particularly for those of us in the eye disease pool. And one of the critical things is I recommend to everyone, just even if it's not in your insurance plan, and I know Heidi talked about sometimes you just have to come out of pocket, to get at least one consultation with an oculoplastic surgeon, or I should say, someone who does either eyelid surgery or other kinds of eye surgery. And sometimes it may seem like overkill, but I tell anyone that I meet who has Graves' disease to see one, to get some initial measurements, because they have some very precise measurements. And so you may never need to see them again, but being able to have that baseline available to you so that if anything starts to feel off, just as Tanya said, don't ignore it and find the right person. And I have a habit that people think is really silly, but it has turned out to be a good thing. Every time I have my labs, I physically print them out and mail them through regular snail mail to each of my members of my care team. Number one, they don't get a whole lot by snail mail anymore. So they actually say, what? And they actually scan it and file it. But also, I want them all to know what's going on at any given time. And so, again, that also happens with my oculoplastic surgeon. Every time he takes his measurements, he also provides them to me, and I send them to everyone in my care team, my primary care doctor, my endocrinologist, everyone. Because again, I treat them as a team, because that's how I've managed all of this. And as my eyes worsen, it's not a good life. So being able to get the thyroid eye disease or Graves' ophthalmopathy, or whatever term you want to use, just make sure you're tracking any eye symptoms from the get-go. And when you first get diagnosed with Graves, go see one anyway. Get those baseline measurements taken. It's a horrible thing to say, but assume that you are one of the people who could have eye involvement somewhere along the road.
And I just want to piggyback on that, because it's not an assumption. Understanding that the thyroid eye disease, there's only 2 places that the protein that the antibodies are attacking exists. They're in our thyroid and they're in some tissues around our eyes. So basically, a lot of ophthalmologists that study this will say everybody is going to be affected by TED. It's just whether or not you're going to become severely more affected. So yes, getting those measurements early on is very crucial. And I just want to make sure people understood why TED happens. And obviously, just like there's levels of severity within Graves, as we're listening to people talk, there's levels of severity of TED. But basically, ophthalmologists that would study this would say everybody's basically affected to some degree or another. That makes sense.
Yeah. And I would add there's a third issue that can occur often in conjunction with TED called pretibial myxedema, which appears typically as a rash on the front of the shin. So, all right. Well, I will refer everyone to the webinar on our YouTube channel with Dr. Eve Bloomgarden and Dr. David Cooper, which really gets into the details of anti-thyroid drugs. When we polled our community a while ago as to what topics they wanted to see, and long-term use of anti-thyroid drugs was actually the #1 topic. So thank you so much to everybody on this panel for taking the time to share your experience. We'd also like to thank the County of San Diego, whose grant funding helped make this program possible. And to learn about future GDATF programs, you can visit our website at gdatf.org. Thanks and have a great day.